You've been in a car accident. The ambulance rolls up. Out jump the EMTs with the backboard in hand. They put you on the backboard and you're on your way to the hospital. But is this a good thing or a bad thing? In my 15 years on the ambulance, I have used a backboard many times. There are many reasons that we use backboards. One of them is spinal immobilization, and the other is ease of transporting. But the argument is growing against the use of backboards. They can cause pain, skin ulcerations, aspiration, and respiratory compromise. So first, let's talk about why do we use a backboard? Well, a backboard offers complete spinal immobilization. This is a good thing. According to the CDEM curriculum, it says early outcomes research associated development of improved spinal immobilization techniques with better neurological outcomes in spinal cord injuries. So it is important when there's a spinal cord injury, it's important to keep that person immobilized until they can get help. Another reason is we use a backboard is for ease of transport. Sometimes we have to get a patient from a very difficult place to the ambulance, and it is much easier to do this when we have a backboard or when we have the patient on the backboard. The emergency medicine news said the backboard is sometimes used to extricate a patient, but that does not mean he has to be transported on a backboard. So what is the case against using backboards? Well, first of all, backboards cause pain. The Journal of Emergency Medicine Services states that even in otherwise healthy volunteers, the resultant pain of immobilized patients has been documented to result in unnecessary procedures regarding the cause of the pain. What does this mean? This means extra money. It costs more when you have to do extra x-rays and CAT scans and other procedures looking for the cause of the pain when the real cause of the pain is the use of a backboard. Another thing that is a trouble or problem with backboards is they cause skin ulcerations. A skin ulceration or bed sore is a very dangerous thing. It's a way of means of getting infections, including staph infections. The Mayo Clinic reports an infection from a pressure sore can burrow into the joints and bones. This is very dangerous and can sometimes be lethal. Another problem is that backboards can increase aspiration. The recommended position for a patient is on their side in order to reduce aspiration. Aspiration happens when a person inhales blood, fluids, or other things. And again, this can be very dangerous and lethal, sometimes lethal. But it's very difficult to put a person on their side when you're using a backboard. The last problem we're going to talk about today is that backboards can cause respiratory compromise. So it's difficult to breathe, is what that means. It's very difficult to breathe when you're lying in a forced, unnaturally flat position. We used to try to solve this on the ambulance by putting pillows underneath the backboard, trying to get the person at an angle that it was a little bit easier to breathe. But the research is starting to show that it's better to eliminate the use of the backboard altogether. The Journal of Emergency Medicine says that spinal immobilization has been linked to respiratory compromise, particularly with the use of straps across the chest, even when not tightly applied. One study found worse lung function test results in healthy, immobilized volunteers. So we can see that backboards do have a few advantages. They can help us provide complete spinal immobilization, and they can help us transport patients from an area where they cannot be cared for to a better area of care. But they have many disadvantages. They cause pain, they can cause bed sores, they can lead to increased incidences of aspiration, and they can lead to respiratory distress. Because of these very pressing reasons, I would ask that we discontinue using backboards. There are many ways to transport patients that are just as effective without the risks. Please consider discontinuing the use of backboards.